Hi, I'm Kevin with Acteon. This is just a nothing fancy, open dialogue conversation about the cube. This video is intended for dealer reps. If you're a dentist or an end user, you can watch the video. There's no harm in it, but the conversation is just meant for the dealer reps. So, first question, what is the cube? The cube is a pre-implant ultrasonic bone surgery device. It's also known as a piezotome or a surgical piezo. Now, unlike a surgical handpiece that spins in a high torque rotary fashion using a cylindrical burr, the cube operates in a linear forward and backward motion using specialized tips to perform the procedure. So, to put it in layman's terms, imagine if you were trying to make a straight line cut in a board with a drill as opposed to a jigsaw. Right? The rotary motion of the drill is going to be a lot harder to control, while the linear motion of the jigsaw allows you to get a more precise cut. So the cube is capable of a variety of procedures, from extractions to osteotomies, sinus lifts to crest splits. Each procedure has its own specific tip kit that contains up to 6 tips for that procedure. So these tip kits are used in a sequence to accomplish the designated procedure. For example, the sinus lift kit right here has 5 tips, right? The first 2 are used to make the window. So you can either use the straight or the round one, whether you wanted a square or round window. Then this, what looks like a trumpet, right, is used to gently make a space between the bone and the membrane. And then the following 2 tips here are used to easily lift the membrane and perform the lifting part of the sinus lift. So all of these tips here are used to perform a sinus lift, hence the fact that they're all part of the sinus lift kit. So who is the cube for? Well, the cube is perfect for anyone placing implants. That's right. If you're a doctor placing implants, then the cube is right for you, right? It doesn't matter if they have placed 10 or 10 million implants. The cube has a place in an office. So perio, GP, oral surgeons, think about your customer base. All right, how many of them are placing implants? Every one of them is a cube potential. Think of where dentistry is headed. Okay, so how many doctors are going to be placing implants this year? Starting fresh, right? New to implants. How many of them are going to be placing implants in the next 2 years, 5 years, 10 years? So think about all of the offices that can benefit from a cube. Now there's also a market for the cube in the hands of an endodontist, although for the purpose of this video, we're only going to focus on pre-implant work that the cube offers. So what are the benefits of the cube? Well, there's a lot, but to condense them down in something easy to digest, we're going to cover predictability, preservation, patient experience, and of course value. So as we all know, or if you didn't know, you will now, one of the key elements for a doctor to be successful when placing implants is for them to be able to produce predictable results, right? When the outcome mirrors expectations, you're able to reach maximum efficiency. Time is money is not only 100% true, but highly applicable in this scenario. So imagine the different times you've heard of an office saying they either broke the buccal plate or perforated a sinus during a procedure. Or what about a GP who runs into a snag during an extraction, is unable to get the tooth out? Now they have to get the patient to a specialist ASAP. They have to refund the money. They lost a day's worth of work, and they're quite possibly losing that customer, probably definitely losing a referral, and the implant case, which was the actual source of revenue, well, that's pretty much gone. So being able to provide predictable results is crucial for the office. Another benefit, of course, is preservation. So due to the intelligent selective cut, which is the distinction between hard and soft tissue, only the bone is cut. So there's no risk of injuring soft tissue, nerves, membranes, arteries, etc. In an extraction using rotary burrs, right, soft tissue is literally destroyed and bone is lost. The surgical recite will require time to heal. Now with the cube, the extraction tips are used to break the PDL. So this is our extraction tip kit, and these tips here are used to break the PDL like a high-powered periotome. This allows for the extraction to be performed without any damage to soft tissue and allow for an immediate placement if the office is looking to do that. Not only does that preservation help the dentist and work hand in hand with the general philosophy of medicine by causing less harm to the patient, but it also increases the patient experience. So surgery, especially oral surgery, is something that the average individual tries to avoid having to experience their entire life. Let's face it, no one wants to go to the dentist, right? No one wants to have surgery. It's scary, it's painful, and it's traumatic. The cube helps to change that. Patients who have procedures with the cube find that it's a less painful outcome. By preserving soft tissue and bone, the patients are able to leave basically with just over-the-counter medicine. There's no scary swelling that's normally associated with these procedures, and it really turns a traumatic situation into an eye-opening, well, that wasn't so bad experience that they actually want to tell friends and family about. Now this leads to positive referrals. And referrals, especially for implants, pay dividends for the value. Dividends for the doctor. The value of the referral is just one of the benefits of the cubes. Referrals, especially for implants, pay dividends for doctors. The value of referrals is just one of the benefits of the cube. The cube is a system that works for and grows with the practice. Now, most offices invest in the cube for the ability to perform atraumatic extractions. As offices become more involved with implants, they venture into more complex cases. Cases that may include crest splits or bone harvesting. The cube will be there every step of the way. Whether the office is just starting their implant pathway or the office has literally written the book on implants, the cube will add value to their office. So, what are customers saying, right? I guarantee you that each of you has an office in your territory that's using a cube or one of our older Piezotome devices. I've yet to meet an unhappy cube/Piezotome customer. These offices will be excellent references for you. I can provide you a long list of quotes from happy doctors, but just as referrals have helped dentists, they help us as well. So make sure you know who your doctors are in your territory that are using the product and go ahead and use them as references. I can tell you for sure that an office using a cube likes to talk about the cube. So, how do you start the conversation with the cube, right? Great question. We're in sales. We need to open up conversation. So I think a lot of you will find that most of the offices have already heard about surgical piezos, right? If they're placing implants, they've probably either experienced them at a course or read about them. So the cube, in most cases, is on a list of wants, right? Many have no idea that you even sell the cube, and also have no idea that the cube is as affordable as it is. The majority of courses use the cube during hands-on portions, and many attendees who are there are also starting their implant journey. So they're looking at CVCTs, implant motor systems, implants, and all of the other gear associated with being implant proficient, right? You may find that the doctors are going to be a lot more receptive to the cube than you might have thought. I found that just asking the doctor if they're interested in a solution that makes the procedures more predictable and increases patient comfort is a great place to start. I made some videos that are on YouTube, which the links are in this video, as well as I can share them with you. And a lot of cases, just sharing these with the doctors is a great conversation opener. Whether you want to email them or share them in person, it's a great route to go. Like I mentioned, many doctors have experience with surgical piezo units, and bringing it back into light often nets great results. Now, the hardest part about being a sales rep, of course, is talking about a product that you might not be 100% familiar with. So, unfortunately, I understand you can't have an Acteon rep in your back pocket all day to answer the questions that the doctors might bring up to you. But the lucky thing is that most of the questions that we get are pretty consistent, right? So here's a few examples of some of the questions that might be tossed your way, and here's how to knock them out of the park, right? So, first question I get a lot is it faster than a burr? The answer is no. A surgical handpiece cuts faster than a cube, right? A handpiece also takes no prisoner. The speed of that burr removes bone, soft tissue indiscriminately. The cube wasn't designed to be faster. It was designed to be more predictable and have safer outcomes. Being faster is not always going to provide the best results. Another question that I kind of get, or that I get often is, can I do scaling and hygiene, right? So a lot of offices are familiar with piezo technology because they have them chairside in their chairs already, and they're using them for hygiene and for scaling. The answer to that question is no. The cube is specific to surgery, right? Now, we do make the piezos for hygiene, but the cube is just too powerful, right? Just as the hygiene piezos are not going to be powerful enough to do the pre-implant surgical procedures. They're just different, right? Now, another question I get is, I don't have any issue with how I'm currently doing extractions. Why do I need an extraction machine? So the cube is not an extraction machine, right? The cube performs brilliant atraumatic extractions, but is capable of so much more, right? Sinus lifts, crest splits, osteotomy, piezo scissions, crown lengthenings, etc. They're all possible with the cube. Sure, an extraction can be performed with elevators or with burrs or with any other current devices, but that's similar to how you can capture an X-ray with film, right? Intraoral sensors have made the experience better for doctors, and the cube is going to make the experience of extractions and pre-implant work better for not just the doctors, but the patients. Now, like anything, right, there's a financial attachment. So another question that I get is, I don't have a budget for it. Okay, so let's just assume that an office does 5 extractions a week at $90 per extraction. That means they're gonna have the unit paid off in a little over 4 months, right? Now, on a bigger picture scale, if an office has 2 very difficult extractions a year that causes them to have to refer out or maybe get a bailout, they could potentially lose the entire case, implant and all, right? If they used the cube and they were able to save the day, the unit's paid itself off with just those 2 cases. Not to mention that offices who might be nervous to work on more advanced cases will find the cube makes it way easier. So crest splits, sinus lifts, osteotomies, these are all procedures that now can be kept in-house, right? That's more revenue being kept in-house. Now, as a sales rep, we always ask ourselves, what's in it for me, right? Why should I sell a cube? Well, a few reasons. One, bluntly put, if you don't, someone else will, right? The data's there. The cube is becoming more and more prevalent. It's more popular. And the first person who brings it up that I find is usually the one who gets a sale, right? So beyond the aspect of just making the sale, the cube offers so much more than just a single sale, right? An office who is able to grow their implant business due to the cube is an office who is able to generate more revenue for advanced technology, whether that's an intraoral scanner, 3D printer. Implants increase the bottom line of a practice. As practices grow, so does spending, right? More implant placement means the purchase of more implants, the purchase of more regenerative products, the purchase of more sundries, and as an office increases their revenue, they develop the ability to have more financial freedom. And in many cases, they're happier. They either can work less and make the same amount of money, or work the same amount of time and make even more money. It's just the possibilities are endless, right? So Offices who might be placing thousands of implants a year will find that their cases become easier and they can increase the number of cases. Or they just finish sooner and enjoy life. It's really a game-changing product for practice for their implant game. Now, of course, as sales reps, we always ask the question, what about consumable business, right? So in addition to the sale of the Cube unit itself, there's a perk of the consumable business, right? Cube tips are like anything else. They have a finite lifespan. The extraction tips, they last between 12 and 15 extractions. So as the offices grow their implant business, they're going to be using the Cube more and more. The greater the usage, the more tips they need. Think of a painter, right? A painter who paints 3 or 4 houses a year can pretty much stretch their paintbrushes for a while. But a painter who paints a house a week is going to go through far more brushes, but their revenue has also increased exponentially. Okay, so what now, right? Just giving you all of that information. What do you do now? How do you implement? Great question. First step, identify the customers that are placing implants. Maybe that's 10 of your customers, maybe that's all of them. From there, start a dialogue about the Cube. Whether you use some of the videos that I have made or send them via email, show them in person, or have a conversation in person, the starting point is key. Someone's going to present the Cube to them. Why not have that person be you? You'll find that some of your customers will just want the price and pull the trigger. Others are going to want more information. If information is more than you're able to provide, no big deal. It's time to bring your Acteon rep into the mix. Now, some offices will want a demo, right? The Acteon rep, whether that's me or wherever you are in the country, can provide a presentation both in person or via Zoom, as well as bring the unit into the office should they want to try it on a live patient. Now, if you don't know who your Acteon rep is, reach out to me. 239-919-0132. I'll have that at the end of the presentation as well. I can assist you. If you're in Florida, Lower Alabama, or the Caribbean, and you just spent the past however many minutes with me, well, guess what? I'm your Acteon rep. Pleased to meet you. So please don't hesitate to reach out to me. I can provide you links, data, documentation, anything you might need. I'm here for you. We want to be successful. You want to be successful. We all work together. This product is an amazing product, and it's a great avenue to take your customers down that implant pathway. So if you have any questions, like I said, I'm Kevin, 239-919-0132. Don't hesitate to call.